Today we are here to discuss the three subclasses of psychotropic drugs. There will be discussion around the indications, actions, dosages and side effects, as well as the nurse's role in the provision and management. Antipsychotics are the most commonly prescribed to patients suffering from acute or chronic psychosis, including schizophrenia. Patients with schizophrenia will present with symptoms such as hallucinations, delusions, thought disorders, paranoia, diminished communication, and bizarre behaviour such as facial grimacing, posturing, catatonia, and waxy flexibility. Antipsychotics are also used in the treatment for bipolar disorders in the attempt to control psychotic symptoms such as hallucinations and delusions. Typical antipsychotics decrease dopamine 2 transmission by blocking the dopamine 2 receptors at the postsynaptic nerve cell, therefore preventing the dopamine 2 neurotransmitters from binding to the receptors in various parts of the brain. Research indicates that the symptoms of psychosis present due to excess dopamine in the brain. As a result, blocking these dopamine 2 receptors helps reduce symptoms of psychosis. Atypical antipsychotics also inhibit dopamine from binding with its receptors at the postsynaptic neuron, however are more selective to particular serotonin receptors, therefore reducing the occurrence of side effects, including movement difficulties, that may arise from typical antipsychotics.
Typical antipsychotic drugs, such as loxapine, can induce severe side effects, and hence patients should be monitored when commencing these medications. These medications may cause acute dystonia, which is sustained muscle contraction, hypertension, hyperlipidemia, and akathisia, which is the inability to sit still. Atypical antipsychotic medications, such as Zolox, produce side effects such as increased weight, type 2 diabetes, tremors, stiffness, decreased libido, and sedation. In the event a patient neglects a medication, depot antipsychotic injections also do exist. For example, flanoxole. These injections are long-acting and slow-released. Injections do, however, have side effects, which include restlessness, agitation, difficulty sleeping, involuntary muscle contraction, headache, dizziness, fatigue, dry mouth, gastrointestinal upset, dyspepsia, and weight and appetite changes.
Typical antipsychotics. Chlorpromazine comes in tablets or liquids given in 25 to 100 milligram doses 3 to 4 times daily. It can also be given as a single stat dose. A dose of haloperidol is 3 to 10 milligrams daily in tablet or liquid form. Short-acting injections or IV doses are 2 to 10 milligrams every 2 to 6 hours with a max of 15 milligrams in 24 hours. Long-acting IM injections are given every 4 weeks. Atypical antipsychotics. Risperidone. Tablets or wafer doses are 0.25 to 6 milligram daily, and long-acting IM injections are 25 to 50 milligrams every 2 weeks. Quetiapine comes in 25 milligram tablets, given twice daily. Olanzapine tablets or wafers have a max dose of 20 milligrams daily. Short-acting injections can be given 2 to 6 hourly with a maximum of 30 milligrams in 24 hours. Long-acting injection doses depend on how much was taken orally. Clozapine tablets and liquid doses are usually 200 to 600 milligrams daily.
Antidepressants are prescribed most often to individuals suffering from clinical depression, where a chemical imbalance of neurotransmitters, including serotonin, dopamine, and noradrenaline in the brain has occurred. Antidepressants are also used for the treatment of many other medical conditions, including generalized anxiety disorder, obsessive-compulsive disorders, manic depressive disorders, social anxiety disorders, and post-traumatic stress disorders. The oldest class of antidepressants, called tricyclics, can also provide significant relief of pain, in particular peripheral neuropathic pain caused by nerve tissue damage. This occurs through the reducing pain signals sent to the brain.
Now I'm going to talk about the action of antidepressants. Antidepressants can be divided into 4 classes. These are selective serotonin reuptake inhibitors, or the SSRIs, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors. SSRIs selectively block the reuptake of serotonin into the presynaptic neuron, and therefore allow the serotonin to remain at the synaptic space for longer and more available to bind to the receptors of postsynaptic neuron. Atypical antidepressants are a newer class of antidepressant that work as reuptake inhibitors. These include norepinephrine reuptake inhibitors, norepinephrine and serotonin reuptake inhibitors, and norepinephrine and dopamine reuptake inhibitors. There are other atypical antidepressants that also work as the receptor blockers. Next, tricyclic antidepressant. Tricyclic antidepressant are older class of antidepressant which increase the level of serotonin and norepinephrine by inhibiting the reuptake of these two neurotransmitters into the presynaptic neuron. And again, they allow these two neurotransmitters to remain longer at the synaptic cleft. And last, monoamine oxidase inhibitors. This antidepressant inhibit the action of monoamine enzyme and therefore increase the synaptic concentration of dopamine, serotonin, and norepinephrine.
Common side effects for SSRIs include nausea, insomnia, appetite changes, loss of libido, dizziness, fluctuations in weight, gastrointestinal upset, or tremors. Atypical antidepressants such as SNRIs, NDRIs, and NRIs have side effects including fatigue, nausea, decrease in body weight, sleepiness, and nervousness. Tricyclic antidepressants such as norepinephrine are associated with a large array of side effects. These include, but are not limited to, decreased sex drive, increased body weight, gastrointestinal upset, fluctuations in heart rate, increased sun sensitivity, and disorientation. Finally, there are the MAOIs, such as Nardil, which may produce side effects such as dizziness, insomnia, increase in body weight, sexual problems, and sleepiness.
Antidepressants, SSRIs. Maintenance doses of more than 100 milligrams of fluoxetine or 50 milligrams of sertraline daily are not usually needed, and 10 to 20 milligrams of escitalopram and 20 to 40 milligrams of citalopram as a once-daily tablet are usual. Atypical antidepressants. Mirtazapine doses start at 15 milligrams up to a maximum of 60 milligrams. Duloxetine is a 30 to 120 milligram once-daily tablet, and 150 milligrams of venlafaxine is usual.
Anxiolytics are used to treat the symptoms of acute anxiety and should only be taken short-term. There are numerous other indications for use, such as muscle spasms in osteoarthritic conditions, acute alcohol withdrawal, insomnia, panic disorders, prevention and treatment of seizures, and as an analgesia to induce relaxation.
Benzodiazepines are sedatives that provide calming effects. They enhance the inhibitory action of the neurotransmitter GABA through the central nervous system, resulting in anxiolytic, sedative, hypnotic, muscle relaxant, and anti-epileptic effects on the brain.
The most common class of anxiolytics, benzodiazepines, have side effects which include drowsiness, slowed reflexes, slurred speech, depression, and disorientation.
Benzodiazepine doses vary, but they all come in tablets given 3 times a day, with temazepam usually being given in one dose at night. Diazepam comes in tablets, liquids, rectal solution, and can also be given IV.
Nurses play a huge role in patient education. By educating patients about their medication, they are more likely to adhere to the treatment and therefore prevent relapse. By having the patient on consistent treatment regimen, they will also reach and maintain the therapeutic effect of the medication. Nurses inform the patient to complete the whole course of the treatment, even though they may feel better and their symptoms may be relieved. Because straying from the medication or lowering their dosage without professional advice may lead to relapse. More clinically, nurses are also responsible for the provision of medication and ensuring that the patients are compliant with them. Nurses also involved in regular patient follow-up to see how the patient is progressing and provide any support to the patient and the family. Therefore, building a rapport with the patient will allow for open and honest conversation between the nurse and the patient. Liaison with the family and carers is also important, as this forms a support network, and will also ensure that the patient is fully supported throughout the recovery, which also again help to prevent relapse.
I hope you enjoyed our presentation, which discussed the indications, actions, dosages and side effects of the 3 psychotropic drug groups, including antipsychotics, antidepressants, and anxiolytics, as well as the nurse's role in safe medication administration. Thank you.